Hello and welcome to Healthcare Simplified, forum to discuss healthcare concepts and latest healthcare news that impact us all, and do that in a simplified form, right? This is Nandini Sahasrabudhe. Let's jump right in. Now that we're fighting with COVID for more than 2 years now, we have to look at how the COVID data looks like. So you see here, it is moving in waves, right? So the cases go up, they go down, they go back up, so on and so forth. And with every wave, we are detecting new variants, new forms of the smart virus, which changes its form slightly, right? So there is a new variant, and it gets us confused again, right? So what do we really want to do now is see how much the number has risen now. So it's important that we take all due precaution, get vaccinated, follow all social distancing protocols, and ensure that these wave pattern doesn't recur and it actually tapers down, right? All of us want to enjoy our lives. Okay, now leaving aside COVID-19, which has been an exception in last 2 years, largely categorizing the health trends into two parts. One, which is non-communicable disease, where the disease cannot be passed on to one person, from one person to another person, and communicable, where the infected person can actually pass on the infection to another person. So in the non-communicable disease trends, this is WHO data, 2000 to 2019 data, and what the trends are telling us is heart diseases outrank many other causes of deaths, right? So it's a huge number of deaths that are associated with heart diseases. Then there are different types of cancers, there are breathing system diseases, and the fourth one, which has slowly creeped up in past few years, and probably many still don't consider that as a deadly disease, is diabetes. Many cases of many deaths are associated with effects of diabetes. What is striking in this trend that we see here is see how Alzheimer and other dementia have risen as one of the key reasons that is associated with deaths, right? So what is dementia? It's forgetfulness, actually. People forgetting due to old age, what we generally otherwise call. So dementia is a clinical state, clinical condition, and that seems to be rising. That's which seems a pretty big change. Now moving on to the communicable diseases, which are which are largely this major ones are malaria, TB, HIV, and so on. The picture is pretty encouraging, right? As you can see, the numbers have dropped significantly. So look at this. So big drop in HIV, right? So quite encouraging there, I think, and a lot of efforts, big consortia, awareness programs, a lot of efforts really to achieve this decline in numbers that we see here. Okay, now moving on to really the breakthroughs. As we have been fighting with COVID for more than 2 years now, I have selected 3 themes for the breakthroughs that we want to discuss first about COVID-19. And first is RNA-based vaccines. Now, with COVID-19, we saw, these RNA-based vaccines being actually realized, right? So a lot of decades of work has gone in, really, but COVID-19 really pushed people right up the wall, and everything was accelerated, right? So what happens in this RNA-based vaccines is essentially the genetic material of this virus is first understood, right? What codes for what is the blueprint telling us? Genetic material is a blueprint. Now there are a lot of components of this virus, right? One is this blueprint. Then there is something called as protein. You must have heard of proteins, right? In when you go for a workout, there are supplementary proteins that are recommended. But everyone, including viruses, have proteins, right? And there is something called a spike protein here, which is on the outside of that virus, right? So it's which you see here. This is there is a spike protein, right? So there is this mRNA which is which is packaged in this vaccine, and then it is given to the person. Now what this packaged RNA does is it tells the cells inside the vaccinated person's body to produce just that specific protein, okay, right? Not the whole virus, right? The person hasn't gotten the whole virus, but just that information how to produce that specific protein in large amounts, right? The spike protein. And what it does is, once that happens, our immune system wakes up because it recognizes that, oh, it's not my own protein, what is this foreign thing, right? So it wakes up and it recognizes that, and it essentially this mechanism educates your immune system to memorize this, and when there is an actual infection, it will strike because it is educated to strike when it sees this spike protein, right, which is very, very specific to this this virus. We'll cover this in more detail probably in coming episodes. But I hope you got the concept across. It opens up a big array of possibilities for all other viral infection, deadly ones, for which there are no vaccines today, right? So a big advancement there. The two next ones that are selected for COVID from the COVID-19 world is now home detection is possible. So there are now these kits available which you can purchase. And if you suspect that there is an infection, you can just do a test at home. RT-PCRs, which are very sensitive, they cannot be done at home. You have to call a pathologist. You have to, like, it costs more, definitely. So these kits definitely, of course, are not as sensitive as RT-PCR, but you can basically do this test at home, which is amazing because that offers a lot of flexibility, right? And it is very simple. It is like how the many of you must have seen pregnancy tests, right? It looks pretty much like this. So the sample is taken from a nasal cavity, like it is shown here, and it is mixed up in a solution that is provided with the kit, and you drop the sample here. If the infection is there will be a signal here, so it will light up, right? So a neat way of doing this checks at home. Then the next one is the oral antivirals. Now why am I talking about that? Many must have heard about remdesivir, which is an injectable antiviral. So people had to be given injections of remdesivir, which is very painful, and it cannot be done at home, right, easily. So now these oral antivirals, which is one from Pfizer and another from Merck, Paxlovid and Molnupiravir, both these will come in form of tablets which you can take at home, right? So they will help arresting the disease in early stages, will not let that go to really bad state, right? So big ones that came in last 2 months or so, these are given emergency approval, so they will have to go through the regular formal approval from US FDA. But yeah, definitely a big ray of hope. And of course the observations will continue, how larger number of people respond to these drugs. That will be observed in 2022. Okay, now changing gears, coming on to cancer, something that people have been looking forward to for many years, and how you can, is there a way to detect without really going deep down where the tumor actually is, right? If it is somewhere in stomach, it's so painful to really, you know, draw a sample from there, which is commonly known as biopsy. Instead of that, if you can just detect that from blood, it will be so much easier, right? Less painful for people to get this done, right? So what this test does is it uses a very smart approach. What happens in tumors is, because it's not designed to get all the nutrition it wants from normal blood system, a lot of tumor cells die because they're uncontrolled, erratic type of big masses of cells, right? So many of them don't get enough nutrition, they die, and they end up shedding their DNA, this genetic material, abnormal genetic material in tumors, in the blood system. And what this test does is it smartly just targets that, and it tries to figure out the patterns from different tumors. In this case, you will see that the healthy DNA, which is also otherwise present in blood, it looks quite different. The pattern looks quite different from different types of cancer like colon, lung, and skin melanoma, right? So the test is called as Gallery from Grail, and if you are interested in looking up, understanding more details, technical details, how the study was done, what are they embarking on, the bigger studies, so on and so forth, is available on the website. And do check out. It's a big advancement, and a lot of new discoveries will be made in blood-based tests in the coming years, definitely. Yeah, now malaria, something that many countries have been waiting for years, especially in African countries. There have been so many people who die because of malaria. Just in 2019, 409,000 people died because of malaria. And now finally we have a vaccine after so many years of work. So a great news for African and also other countries who suffer from this deadly disease burden, right? So good efficacy of 77%. Now WHO is recommending this vaccine. The initial studies is done in 450 children, and now they will take it up to a large set of children, right? So something very encouraging. Next is something probably not many of you might have heard about. Is called as gene editing, and it's a very cool discovery that was made, that was published in 1920, 2019-2020. Basically what it lets you do is really repair the faulty piece of our genetic material. If you know what to repair, you can now actually do that. It's no longer a science fiction, and it is gotten into clinics now. So what is this system called? It's called as CRISPR-Cas9 system, and these two great scientists won a Nobel Prize in chemistry for their discovery in 2020. Now, why am I discussing that in as a recap of 2021 is because it got into clinics, and something called as hereditary transthyretin amyloidosis could be actually treated using this. So don't really worry about what these terms are. Hereditary transthyretin, essentially what that means is it's hereditary, so this faulty genetic material goes from generation to generation, passed on, and people suffer. And in this disease there is something called as a protein called as amyloid, which wrongly gets accumulated in different organs and causes a lot of issues. So Intellia Therapeutics published this study in 2021 where they used this CRISPR system to actually treat these patients. And this is such a big thing because now there is a whole new set of possibilities for many deadly diseases which actually do not have a direct medicine, and where we know what is the genetic fault that is there, and there is a possibility that it can be treated now. Okay, now that brings us to the end of our first episode. I hope that you really liked it and you find the value in it.